The Health Services Training Project, a collaborative program of United Cerebral Palsy of Greater Birmingham and the University of Alabama at Birmingham present Disability Etiquette. In this program, you will consider effective communication with those who have disabilities and their caregivers.
Hello, my name is Dr. Hughes Evans. I am the Medical Education Senior Associate Dean of the UAB School of Medicine. May I introduce Ms. Priya Shandon. Priya is a student in the Joint Degree Program in Medicine and Public Health at UAB and a sibling of a person with a disability.
Thank you, Dr. Evans. It's a pleasure to be here.
We want to discuss several issues that are important when caring for those with disabilities. In this module, we will present disability etiquette and general rules for patient-provider interactions. First, let's talk about communication. Acceptable language always puts people first. For example, you should say person with a disability, not disabled person. Try using person who uses a wheelchair instead of wheelchair-bound or confined to a wheelchair. Also, avoid disempowering words such as victim or sufferer. It's important to demonstrate respect. We should always use age-appropriate tone and language. For example, do not raise or lower your voice unless asked. Use simple words, clear directions, and concrete examples. You could say, how many pills did you take today? Versus, did you take all of your medicine as prescribed? When possible, remove distractions such as telephones and frequent interruptions. Always speak directly to the patient. Position yourself to be at eye level with them. You may have to sit in a chair to accomplish this. It's important to be patient when interacting with someone who has a speech difficulty or processes information slower than you do. Do not interrupt or finish his or her sentences. Ask the patient to repeat when you do not understand. A caregiver or aide may help you to communicate. It may also help to use paper and pencil or an assistive communication device. Priya, what other points do you suggest?
We should never assume that a disability means impaired function or cognition. Adults can generally make their own decisions unless you are informed otherwise. Ask an individual before assuming that help is needed. Also, place needed items within an individual's reach, and remember to be sensitive about physical contact. Wheelchairs and assistive devices are an extension of an individual's personal space. For example, leaning on a person's wheelchair is disrespectful. In this example, you see the provider speaking directly to the consumer at eye level, not to other people in the room. This communicates respect.
Patients often are eager to please their healthcare provider. Therefore, they may say what they want you to hear, such as agreeing that they remember to take their medicine daily. Restate questions to probe for understanding. For example, instead of asking, do you take your medicine every day? Try, how often do you take your medicine? Be patient. Allow as much time as possible for patients to respond and ask their questions of you. I found it very rewarding to care for patients with disabilities. By following these simple guidelines, I'm sure that you will too. Thank you.
This program presented disability etiquette for faculty and students in the health professions. Be sure to visit our website at www.ucpbham.com. You may download as a PDF an explanation and examples of People First language. This program was produced by the Health Services Training Project with support from the Alabama Council for Developmental Disabilities and National Network of Libraries of Medicine. Be sure to view other programs in the series. Helpful forms and links to websites may be found at www.ucpbham.com. The contents of this video do not necessarily represent the views or policies of the Alabama Council for Developmental Disabilities.